Welcome to another interesting edition of the Climate and Health Outlook for September 2022. From the Nigerian Meteorological Agency, I am Dr. Imara Joyce Nchom. Climate change is impacting human lives and health in several ways, and this threatens the essential ingredient of good health, which poses many threats to the health and well-being of man. As always, the Climate and Health Outlook is a climate-smart tool that serves as an early warning mechanism used in assisting the health sector and relevant stakeholders to manage climate-sensitive disease risk by making available risk and vulnerability maps of climate-sensitive diseases and other phenomena across the country and possible advisories. In August 2022, the Department of Public Health in the Ministry of Health, YOLA, reported 11 confirmed cases of cholera in Adamawa State. Disease Vigilance Outlook for September 2022. Malaria. Predicted values of climatic indices show that malaria parasites are expected to persist across the country, but in varying intensities in September 2022. Malaria vigilance across the country. High vigilance for malaria is expected over the south, east, and most parts of the western and central states, stretching to some parts of northern states like Kebbi, Kaduna, Kano, Bauchi, Gombe, and Adamawa states, while moderate vigilance is expected over most parts of the northern region and some states like Plateau, Bauchi, Kaduna, and Oyo states. Advisories. Avoid exposure to mosquitoes as much as possible. Endeavor to see the doctor in the event of any illness and take medication as prescribed. Drainages should be cleared frequently and the environment kept clean. Use insecticide-treated mosquito nets. Cholera. There is a likelihood of the occurrence of cholera in some parts of the country. The levels of cholera vigilance across the country vary. High vigilance is required over the entire north, west, and the following states in the central region. States like Niger, the FCT, Kwara, Kogi, Adamawa, Taraba, and Nasarawa, while moderate vigilance is projected for the entire east, south, and most parts of the central states and some states in other regions of the country like Edo, Delta, and Oyo. Advisories. The following precautions against cholera are advised. Frequent hand washing with soap is expedient. Ensure proper environmental sanitation. Ensure that food and water are not contaminated. Infected patients are advised to drink lots of water. Medication instability. The predicted temperature and relative humidity values across the country for September 2022 satisfy the conditions for medication instability, a situation where degradation in the composition of medicines is anticipated across the country at different degrees. Vigilance. High vigilance for medicine instability is required over most northern states and some states in the central region and parts of the southeast like Anambra, Enugu, and Ebonyi states, while moderate vigilance is anticipated over the southeast and southwest, including Kwara and parts of Niger in the central region. Other states are Bauchi, Jigawa, Yobe, Borno, Kogi, Plateau, Nasarawa, Niger, and the FCT. Advisories. As always, more caution must be applied in areas with high vigilance threshold while transporting and storing medicines. Temperature and humidity control and monitoring systems for transport and storage are therefore necessary. Similarly, medical personnel should ensure that patients store their medicines under favorable conditions. Heat index. The heat index has important consideration for human body's comfort. Vigilance for heat index. High quotient threshold of heat index is predicted over the extreme northern parts of Borno and Yobe states, while caution threshold is predicted in most parts of the country. No caution is predicted for heat index over parts of Oyo, Osun, Ekiti, Kwara, Ondo, Kano, Kaduna, Bauchi, Plateau, Nasarawa, and Niger State, and the Federal Capital Territory, Abuja. Advisories. A high heat index is foreseen at the northern fringes of Borno and Yobe states. Hence, the following precautions for protection against the hazards are usually recommended. Use shade for outdoor work sites and other outdoor activities. Then schedule work earlier or later in the day when the weather is usually favorable. Then limit strenuous work during hot weather. Drink enough water or other healthy fluids frequently to keep the body hydrated, and wear appropriate clothing for the weather. For further inquiries, visit our website at www.nimet.gov.ng and our social media handles as displayed on the screen. Like the saying goes, what happens in the Arctic does not stay in the Arctic. Hence, remember to always be climate smart. Bye for now till I come your way again next time. Bye.